Welcome, everybody. I'm Chris Kane, Executive Director of CPWR, the Center for Construction Research and Training. And I would like to welcome you to today's webinar, CPWR Physicians Alerts, Short Guides to Talking to Your Medical Provider About Work-Related Hazards. Thank you very much for joining us. We recently put out a new Physicians Alert for pregnant construction workers. So we thought it would be a good time to do a short webinar reviewing this set of resources meant to help initiate or improve communication about workplace hazards between workers and their doctors. And now I'm pleased to introduce today's CPWR panelists. Jessica Bunting is our Director of Research to Practice, and Rosa Greenberg is a research analyst in the Research to Practice team. Jess, I'll hand it over to you to get us started.
Great, thanks, Chris. Let me go to the first slide here. Thank you, everyone, for joining. It's fun to see where you're all from in the chat. We appreciate your interest in this topic. And before we look at the physicians alerts today, I wanted to just get into some background on why CPWR developed these. And I'll just note that, obviously we only have 5 topics. We already have ideas for other topics, but if there are topics that you want to see that we don't talk about today, put them in the chat, shoot me an email. We're always open to hearing what else we should develop. So just talking about sort of the motivation a little bit for these, we often focus so much on occupational injuries in construction. They're well researched, they're better understood, and there's limited information on construction worker deaths that happen off the job. Despite all of that, we do know that many worksite exposures are hazardous. They can have lifetime health impacts, such as causing cancers. And we just don't know as much due to the length of time that it takes many of these health conditions to develop in comparison to the acute nature of injuries, right? So what we have found, our data center has shared in a couple of reports, and I wanted to highlight one from last January, so about a year ago, January 2023, they put out a data bulletin on leading causes of death among current, retired, and former construction workers. And so, prior research has shown that there are health effects. For example, that 19% of construction workers had a respiratory disease, 26% had experienced cancer, diabetes, or heart, kidney, or liver disease. And so we wanted to dig a little deeper into these things. And then as the demographics of the industry shift and have shifted, continue to shift, there's also an expanded need for different resources. So I'm going to share some of that data as well on things like women in construction. So looking at this specific January 2023 data bulletin, our data center broke down causes of death. They looked at both major categories, and then they also looked at detailed causes of death. I will drop the link to this in the chat, or if Rosa, if you're able to find it and drop it in the chat, please go ahead. But it can be found on cpwr.com, and I think I do think I put the link in the slides as well. But looking at just a few of the charts, we can see that the top major causes of death do vary quite a bit based on age, as we might expect. So if we look at younger construction workers, so taking those in the age group of 16 to 34 years old, the majority of those, are 55%, died by an accident. Whereas looking at the older age groups, we can see that 67% of those in the 35 to 64-year-old group, and 87% of those 65 and above died from quote unquote natural causes. And then heart attacks or ischemic heart diseases being the top cause there. So if we dig into that a little bit deeper, and look at the detailed causes of death, you can kind of see our train of thought as to why we developed some of these resources. So looking at 16 to 24-year-olds, we can see that accidental poisoning by and exposure to narcotics and hallucinogens is at the top of the chart, followed by other drugs and substances. Looking at the next two age groups, you're going to see that COVID-19 is the leading cause of death, and that's, because this is from 2020. So of course, that's sort of unique to this time period, but it is interesting to note that it is a contagious disease that impacted these groups the most. Following that up, we again see accidental poisoning and exposure to narcotics and hallucinogens. But what's new here for this group is the 3.8K under malignant neoplasm of unspecified part of bronchus or lung. So that's pretty significant for lung disease. And then again, I already mentioned that the 65 and up group was extremely affected by COVID-19 at the time that this data was pulled. But then we also see here a lot more of the heart disease, and then again, the lung disease, COPD is new on this page. And so, the diseases and the illnesses, the health effects that take a little while to show up, we start seeing more in the older workers. I mentioned that we created a number of topics based sort of on not only this data, but just our knowledge of the industry and the exposures that are being seen. And so we started our collection off on the topics of contact dermatitis, silicosis, and silica-related illness, and then work-related asthma. We pretty quickly realized that we needed one on pain management and opioids. And I think these charts that I've just gone over really point to why, just based on the fact that our industry has been impacted by the opioid epidemic, more than any other. And then speaking to the recent one that Chris mentioned that we added on pregnant construction workers, we noticed through our data centers research that women are starting to make up more of the industry, with almost 11% of the construction workforce identifying as female. And while not all of these women are in physical labor or blue collar positions, many are, and many more are being recruited to these types of jobs in the trades. And so it's important that we think about the issues that affect their health and safety as well in the long term. And so based on that, what are the physician's alerts? What did we come up with? We developed these sort of two-part resources to ensure that construction workers are properly diagnosed and treated or accommodated when it comes to work-related illnesses or challenges. And so each one of these is available for free. They're all available in both English and Spanish. So the slides today include the English versions, but if you click on the link that I shared in the chat, you'll see that all of them are also available in Spanish as well. And then each of them has information for the worker about best practices, tips, and resources, as well as information for the doctor or other medical provider on the hazards the worker might be facing, some screening methods, and accommodations or treatment plans that are recommended. And again, just outlining the topics that we currently have. It's dermatitis, silicosis, pain management, work-related asthma, working safely while pregnant is our newest one. And then I'll just mention briefly that to supplement all of these, but really spurred on by the working safely while pregnant physicians alert, we just developed a sort of appendix, which Rosa is going to talk more about. And that is the work-related task list by construction occupation. These lists outline the potential tasks expected of each occupation or trade in the industry. And so we anticipate users that they can go through the whole appendix. They can pull the task or tasks that relates to their job, and then they can use this with any of the physician's alerts that we have to help facilitate the conversation with their doctor about what exposures they might encounter. And so I'm not going to spend a ton of time. You can check these out online yourself, but I do want to just give a brief overview of each of the resources that we have before I hand it over to Rosa to highlight our newest ones. So contact dermatitis focuses obviously on possible skin exposures and also steps that can be taken by the worker to protect the skin and prevent dermatitis. It points people to resources like CPWR's website, choosehandsafety.org, which walks users through selecting the right gloves and hand tools for the job and chemical exposures that are going to be faced. And then for medical providers, it goes a little bit deeper into the types of materials, the chemicals, the substances that workers might be exposed to. It provides some questions that the doctor can ask the patient that might help them in diagnosing contact dermatitis. So for example, how long have you had this skin problem? Does it get better after you've been away from work for a little while? And then finally, we've included a chart that provides an overview of common skin disorders, the chemicals that may cause them, and then symptoms and interventions or treatments, again, to help guide the medical provider through their treatment plan. The silicosis and silica-related illnesses PA was developed to help workers exposed to respirable crystalline silica, which fortunately is getting better. The numbers on that are going down thanks to the OSHA rule. But this PA provides information again for workers to be able to better protect themselves, and then for doctors to be able to better diagnose and treat them. So the worker section outlines best practices, things like using a vacuum system and wet methods to suppress dust, things like using a respirator and having it fit tested. And then the doctor's section again includes more detail about what is silicosis and how to diagnose it, because in this case, it specifically is a work-related illness, right? They, as a doctor, unless they're an occupational doctor, they may not have seen much of this. They may not have experience in it. And then it also includes some important information about mandatory reporting to the health department, as well as resources, linking out to additional resources, one of which is CPWR's website, silicasafe.org. That has a lot of information on protective measures, as well as more detail on OSHA regulation for construction, general industry, and oil and gas. If you haven't checked it out and you have employees or you yourself are exposed to silica dust, I would recommend going to that site. We have a whole exposure control plan tool that easily pumps out an exposure control plan, so we avoid ever being exposed to silica in the first place. Next up, we have the work-related asthma alert, which was one of the first three that we did. And it was developed to support workers at risk of developing asthma, as well as those workers who already have asthma that might be worsened because of work-related exposures. So similar to the others, the worker portion of this includes best practices, such as wearing a fit-tested respirator, and monitoring what makes your asthma worse. And the providers portion describes the types of materials and chemicals that can lead to WRA. And again, this one provides some questions that can aid in diagnosis, such as, was there an unusual exposure at work within 24 hours before the initial onset of symptoms? And then the third page that you can see on this slide includes a table of potentially hazardous substances and what tasks might expose workers to those substances. And then finally, again, possibly our most important physician's alert, I think, is the pain management one. Again, just because of the sheer number of people impacted by opioid addiction in our industry and how much of that begins with a prescription. So, at this point, I think we can all agree it's no longer really up for debate whether or not opioids are addictive. We know that they are, and we also know that anyone is susceptible. You don't have to have a history of addiction. You don't have to have a family history of addiction to be susceptible. And so the best way to avoid becoming addicted is to avoid taking them altogether. Unfortunately, in many cases, I think doctors are too ready to prescribe them. That seems to be changing a little bit, but the idea behind this resource is to better educate workers around the fact that opioids may not be the best option, and they certainly shouldn't be the only option considered. And so we actually have a number of other resources devoted to primary prevention of opioids, like our Best Built Plans resource that focuses on preventing strain and sprain injuries. We have an opioid awareness training, all of which are free. And I'll drop some links to the chat in those momentarily or share them in the follow-up email. But this PA, I think, adds a really important piece to the package of resources, just because, again, a lot of this addiction is starting with a prescription, starting in the doctor's office. So the physician's alert provides workers with some more information about what different types of opioids exist and how addictive they can be. It provides some questions to ask your provider to determine if there's a better course of treatment. The provider section explains the nature of the construction industry and how being injured, being in pain, or being on opioids can affect their work and their livelihood. It encourages doctors to think about treating pain in the greater context of the job and the culture of the industry. And then again, it provides a lot of other resources and references that can be linked out to. And with that, that brings us up to our most recent resource, and I will hand it over to my colleague, Rosa Greenberg, to talk about the Pregnant Construction Workers Safety and Health PA.
Thanks, Jess. So we developed this alert as a resource for pregnant construction workers and an awareness tool for their healthcare providers so that they can understand the occupational safety and health hazards that are faced by pregnant workers and provide care accordingly. In the patient information section, we provide information about pregnancy and health, hazard communication, and rights for pregnant workers. In the pregnancy and health section, there's information about key facts about how pregnancy can affect workers' bodies, like decreasing heat tolerance or necessitating an updated fit for personal protective equipment. We also provide information about hazard communication rights and employer responsibilities. Since some chemicals that are used in construction are endocrine disruptors, which means that they can interfere with normal hormonal function, which can then impact a fetus. This section also includes an overview of workplace rights. Workers have rights during pregnancy and as new parents under federal law, and depending on where they live, under city and state law. And this section provides an overview of some of those legal protections. And it's important to highlight that the Pregnant Workers Fairness Act, which was passed in 2022, and it was implemented just last year and is described in this document, really expands those rights. This law gives pregnant workers who work for employers with 15 or more employees the right to receive reasonable accommodations for pregnancy, childbirth recovery, and related medical conditions like lactation and postpartum depression, as long as those accommodations do not create an undue hardship for employers. So each of these sections also provides links to additional information, including a link to a free national multilingual legal helpline for pregnant workers. Next slide. So the second half of this alert provides information for physicians. And it's really important for physicians caring for pregnant construction workers to be aware of key facts about their work contexts. like possible workplace exposures and resulting accommodations. Possible accommodations for pregnant construction workers could include things like limiting exposures to specific major hazards, like radiation or lead or asbestos, limiting exposure to chemical hazards, and limiting exposure to loud noises that can damage developing fetal ears. Other examples of accommodations could include updated personal protective equipment as workers' fit needs change throughout pregnancy, ensuring bathroom access and breaks, or providing more water and breaks, especially when working in indoor or outdoor heat. This section provides information and resources for healthcare providers about how to write accommodation letters in the most legally protected ways possible for workers. And nonprofit groups and legal resource centers have created those resources for providers that are specifically about how to do that in the safest way possible for workers. In addition, we also include a section about context about construction for physicians, such as the information that pregnancy accommodations can help workers keep their jobs, but a lack of accommodations can be a factor in workers leaving their jobs, and possibly losing access to critical employment benefits like health insurance. A 2021 survey of 2,635 women and non-binary tradespeople by the Institute for Women's Policy Research found that 2 in 3 women and non-binary tradespeople reported that lack of pregnancy accommodations were very or somewhat important reasons for leaving or for thinking about leaving the trades. And this finding underscores how safer and healthier working conditions for pregnant workers are an important part of supporting and retaining women and non-binary workers in the industry. Next slide. So as part of the process of creating this alert, we received feedback from the Tradeswomen Committee that it would be helpful for workers to be able to provide more information to their doctors about what they do at work. So we developed a resource that provides work-related task lists by occupation that can be used with this and with any of our physicians' alerts. While physicians are responsible for providing care and for recommendations about accommodations, there's just a really wide range of how much information they have about what's involved in a construction job. And the goal of this product is to help workers in providing clear information to their providers about what tasks are involved in their jobs. So to create this resource, we use the Occupational Information Network, ONET, which is a national database of information about occupations, as our key source. And first, we identified all construction occupations listed by apprenticeship.gov, and then we pulled the corresponding list of tasks by occupation from ONET. We then reviewed these lists and edited them with support from industry representatives, from unions, and from other experts, and we removed and consolidated occupations accordingly. Next slide. So here's a list of the occupations that we ended up with for the final product, and in it, details are noted. In the product, details are noted beneath each task list that lists which ONET jobs were consolidated, if any, for each of these categories. So workers can take these task lists to their doctors to help their providers understand what's involved in their job and what care or accommodations or other considerations their physicians might recommend. Next slide. So each task list looks like this. They are available in English and in Spanish, and these overviews do not encompass every construction occupation and possible task list. Users are encouraged to use the blank spaces on each page to add relevant tasks as needed, and there are also checkboxes so workers can clarify which tasks are relevant for their occupation. Next slide. So that is it from us. Thank you so much. I think we are ready for questions.
All right. There's been a couple questions coming in through the Q&A, but I'm going to start with the ones that were submitted during the registration process. So if folks have questions, you can either put them in the chat and I'll do my best to get to them, or in the Q&A box if you're live online. But the first question that came in the registration process is for Jess, and that's have these physicians alerts been reviewed by a board certified occupational health physician?
Yeah, thank you. I think I saw that come in through the chat again as well, and they have. So the initial ones were developed back when we had Dr. Laura Welch on staff as our, I believe Chris, she was our medical director for many years until her retirement, and she is an internist, an occupational medicine specialist. And then the most recent one on pregnant workers was reviewed by Dr. Rosemary Sokas out of Georgetown University, who works with us regularly. She's also an internist specializing in occupational and public health. And Dr. Mariah Zlatnik also looked at the most recent one as a perinatologist, as a specialist in pregnant people. So they have all been reviewed by medical professionals as well as other stakeholders.
Absolutely. Thanks, Jess. Rosa, is there a list of construction light duty jobs?
So we do not currently have that resource available or know of it. And if anyone on this call has information about that kind of list, please reach out. I would flag that the task list by occupation resource, though, that we've developed could be used to identify which jobs could be most easily modified to be light or to be lighter duty jobs.
Okay, thank you. Also for you, Rosa, would these physicians alerts be useful to community health workers who have clients that work in construction?
Absolutely. We call them physicians alerts, but they could be used by any medical provider, by paramedical professionals, by public health workers, by community health workers. Could be used really widely.
Yeah, we've actually had it suggested that we change the name of this series of publications from physicians alerts to practitioner alerts or something similar to that, just to make it clear that, you know, they can be used by different medical type folks. One for you, Jess. What are the biggest social determinants of health factors that are causing barriers to workplace wellness? It's a pretty big question.
That's a loaded question, but yeah, I mean, I think we all understand that there are numerous work-related determinants at play in the construction industry. For example, workers may work long and irregular hours. You know, the shift work is a factor. They may struggle to find long-term stable employment. The economy has been good for a while, but you know, I think there's always the anxiety that comes with this type of impermanent position for a lot of folks. And in many cases, there are times where workers have to follow the work to stay employed, right? So they have to be away from their families, they have to be away from support at home for long periods of time, and they have to be away from their regular doctors. They may not have access to health care on the road, but they also may not have access to healthy food and healthy habits, exercise on the road. The hours of the job are long. Many workers don't have paid leave or time off to see a doctor and take care of their health. Many day laborers or those working for small contractors also don't even have health insurance. So even if they can find the time, you know, there's the whole financial aspect of getting health care. And then, of course, the demographics of the industry are a factor. Many workers may be at risk due to non-work related social determinants as well. So, for example, there are a lot of immigrant workers, young workers, folks with limited education and literacy skills. And we know all of that plays into health equity as well.
And just a commentary, I think, you know, the way you approached the answer to that question is really important because a lot of people who use the term social determinants of health never think about employment. And this is what we think about at CPWR as social determinants of health. And there's a lack of recognition outside of people involved in occupational safety and health, how important work is to health outcomes. So that was a great answer, Jess. One for you, Rosa. What's the best way to inform my medical care providers of my past and present employment in the building construction field?
Yes, so we recommend having a direct conversation, and the goal of these resources is actually to facilitate that type of conversation. As a patient, you likely have the opportunity to put this information on a form, but with so much information coming at your medical provider at once, it's likely best to also communicate it verbally and face to face. And it's important when explaining your employment to express concern about exposure to specific work-related hazards. And also to make clear that resources are available. Your doctor might both not be familiar with the occupational safety and health risks associated with your job, and also be unaware that resources exist to support them that are tailored to healthcare providers specifically.
Great, thanks, Rosa. For Jessica, please address ways of informing physicians and workers the dangers of prescribing opioids. And I know you covered some of this in your talk, but did you want to say anything else about that question that came in before the webinar?
Yeah, I did. I think I talked about it from the employer-employee perspective. We have a lot of resources geared toward training around this, and I dropped the link in the chat. But one thing I didn't talk about was that we worked with the Frameworks Institute to do a report on primary prevention and how to better communicate to medical providers and other folks about opioids. And I am going to find that link and also put that in the chat momentarily.
Great. So there were a few other questions that came in prior to the webinar that we won't be addressing because they're kind of out of scope of the webinar, but they really do actually help us think about topics for future webinars. So even if we don't answer your question that you've posed online or today or in advance of the webinar, it does help us think about what we should be covering and whatnot. In the chat, there's a few questions. One that some interesting suggestions on how to rename this series. One question is, are you considering adding physical demands to the work-related task list?
Does that mean like the load that people would be expected to carry? I'm not exactly sure what.
I think it's a great question. You know, I'm interpreting it as meaning, yes, these are tasks associated with the job, but how physically strenuous is each task? And I think that would be a really, really amazing thing to know, but I don't think anybody's actually quantified all of the tasks in all of the construction trades so that we could provide that information to physicians. I think that the workers, as they're talking to their physicians about the tasks that they do, can describe the relative physical loads of their tasks very well. But it's a great data point that I wish, you know, we just could push a button, find and provide for folks. One other question is, did you consider a handout related to noise, or is it understood that the exposure is well known to most physicians?
That's a good idea. We have developed a lot of other materials around noise. We've really been going at it from the angle of trying to make sure everyone is provided hearing protection that works, that's appropriate for the job, making sure that they're using it, buying quiet, looking for tools that don't generate as much noise, but we haven't approached it from this angle, from talking to the physician. And yeah, I think that would be a good one to add.
All right. There's a question here about asking if tobacco smoking was mentioned as a risk factor for death. I think the information that Jess went over from our January 2023 data bulletin was more of the diseases that cause death versus the causes of those diseases. We can't get that granular in the data set that was analyzed. Likewise, it would be really great if there was a way to track the specific exposure to the disease outcome, but we don't have that information. Just a question of who sponsors ONET and how do they get their data?
I am not sure who sponsors ONET. I know that they're the resource that is looked to for apprenticeship.gov and for other federal resources describing tasks related to different occupations, but I can look into who sponsors ONET. I'm
Yeah,
not.
I'm pretty sure it's a Department of Labor database, but oh yeah, I'm being recorded, so you might quote me on that. If I'm wrong, I'm wrong. Um, all right, I'm just looking through the questions. Bear with me for a minute. Are you considering extreme weather exposures, extreme heat or extreme cold?
Again, we have not thought about a physician's alert on that topic. It might be something to consider if we can think about how to frame it with enough information for medical providers that would be relevant. We do have other resources, and I'm just going to put the link to all of our hazard-specific resources in here. For those that the topics that we have big collections on, we've broken our resources down by topic. But then when you click on this link, you'll also find that there is publications by type. So we have Toolbox Talks and Hazard Alert Cards are two of our most popular resources. We have each of those focused on cold weather, heat, lightning, things like that, and noise and all these other topics that have been coming up. So just because we don't have a physician's alert on something, just means that we haven't gotten there yet, but get pretty much guaranteed if you go to cpwr.com, there's something on any topic that you're looking for. And again, I'm going to take these ideas and run with them as far as creating some new ones. So thank you.
Great. One theme that has come through both in the Q&A and in the chat is there a way to consider adding chemical exposures to each job function? And I'll respond to that because there's a real lack of good information as to what chemical exposures are associated with tasks and trades, especially in construction, but I think across all industries in the US. The last time that the federal government really examined what exposures occur in what job type settings was in 1982 when NIOSH did a survey called the National Occupational Exposure Survey. So there is not a comprehensive database of exposures by trade. At CPWR, we have developed these kind of frameworks, and I would be willing to share them with anyone who wants to follow up with me separately as part of kind of a mini job exposure matrix by broad categories of exposures like solvents versus the individual solvent chemical makeup of each solvent, or insulation materials or lubricants or paints or epoxies, things like that. But getting down to the granular function of what construction workers are exposed to on a chemical by chemical basis is not something that that anyone has really done since 1982. So I think it would be a great idea if there were resources available in the federal government to really do a good exposure survey that was comprehensive. However, it does not really exist.
Yeah, I will say when we set out to create, I see Rosa smiling, when we set out to create this list of tasks, we tried to pair a list of chemical exposures with it. And we ran into exactly the issues that Chris is describing, that it just was not possible to create a comprehensive or accurate list by trade or task. And so we didn't want to hold up the development of our resources. We haven't ruled it out. We just were not able to accomplish it right now.
Yeah, and Jess, if you could put my email in the chat, the couple people, I think it was Anne and Mark, who raised the issue of chemical exposures. I'm happy to share what we have and what we've developed over time, but it's not something that's really suitable for publication in my view. This is the $1,000 question or $1 million question. There's a question, these are a great tool, but how do you reach physicians with these alerts? What types of physicians do you report to? Occupational toxicologists? I think that's a great question. The tools are really aimed for workers to carry to their own doctors. So I don't know. We do not have a way to get these in the hands of physicians directly. We've thought about different ways, but I don't know, Jess or Rosa, if you wanted to respond to that.
Yeah, I mean, if anyone has suggestions, we are open to them. We keep a contact database with folks that are intermediaries like medical providers, but it's certainly a category that we're lacking in. And like Chris said, we've been targeting workers with these so that they can take them to their medical provider. But I think that occupational health doctors, nurses, all of those folks would be a great intermediary group for us to work with to reach even more workers. So definitely, if anyone has any connections or suggestions, we are open.
Great. All right, with that, I'm going to go ahead and wrap up. I wanted to thank you, Jessica and Rosa, for presenting today, and thank everyone who's been in attendance. We really appreciate the questions, and I'm thinking about some that I didn't actually mention, and it'll help us inform future webinars, but really appreciate everybody participating today. Thank you to our translators, and we tried to talk slowly. We did our best. And as we said earlier, we'll be sending out a copy of the presentation, a link to the recording, and other resources after the webinar in a couple of days. Thank you so much. Have a good afternoon.